I made the executive decision to just stop all 4 medications and see what would happen. Taking the time to really understand what is going on and just hearing what the person has to say probably leads you down the right path. Time sometimes is part of the medicine. Recently, I went back to Taiwan for a funeral, and unrelated to this, I also, of course, met up with my grandma, who, as most Asian parents do and grandparents will start telling you about all their ailments and whatnot. As we were chatting, my grandmother had complained that she had been having a cough that had been going on for 6 months straight and had gone to the doctor numerous times, and at this point in time was on 4 different cough and allergy medications. Unbeknownst to her, also related, at the same time she had started feeling more fatigue. Well, the thought was that she maybe had an infection or something of that nature that was causing her to feel all these subsequent symptoms. So, x-rays, CT scans, and in the end, they didn't find much, but at the end, she was on 4 different allergy medications. So taking the time to parse through her daily 8 to 10 medications and figure out what each one was for, it was clearly obvious that she didn't have allergies. In fact, I asked her straight if she had any runny nose or any symptoms of allergies, and she said, no, I never had any of those. Taking the time to really understand what is going on, and of course, just hearing what the person has to say probably leads you down the right path. Just to give a little bit of context, at least with healthcare in Taiwan, it is free and universal, but the time with the doctor is relatively limited. You're talking like 3 or 5 minutes max with being able to discuss your issue and then see the doctor, and then that's your entire appointment. It would not be hard to see why she ended up on 4 different medications, given her complaint of her symptoms without any obvious other source. Well, as an executive decision, after spending about maybe 30 minutes to 40 minutes to figure out what exactly was going on, I made the executive decision to just stop all 4 medications and see what would happen. Well, lo and behold, a day or 2 later, she was still coughing, but not any worse than usual, but not any better either. However, during that time, since we stopped 4 of those allergy medications, all of which we know can be a little bit sedating, otherwise make you want to fall asleep, she instantly told me that she wasn't dragging herself out of bed in the morning. Of note, she does have 2 caretakers who help her with her daily life activities like feeding and washing, and they instantly also noticed the difference as well, and magically seemed like her energy had came back. Well, taking again the time to listen and hear that the thing that made her cough the most was cold air or something that irritated her throat, we tried 1 new medication, and within that same day, her cough had stopped. Relatively a small improvement, nothing dramatic or saying that's life-changing, but in the sense that we can prevent a lot of unnecessary treatments and really take the time to improve somebody's life if we take the time to listen. And that's what I think we can offer here at our clinic. Not to say that other doctors or other offices are not trying to do this, they are. But given the constraints that they have with the way the healthcare system is set up and with the way of the middleman of the insurance companies, and it's not set up for optimal success and the sometimes necessary time to really give the attention it deserves. At least here, we hope to make that the rule and not the exception. Time sometimes is part of the medicine. One thing about the annual physicals that we have here, even though we don't have a better term for it, it's called the executive physical to kind of differentiate it. It really looks at a lot more markers that we typically would not in the standard clinic. And I say this only because I've worked in the standard clinic and now I'm trying to improve things that we have comparatively from there. More in-depth cardiovascular testing is #1 and a priority, only because that is still the #1 killer in the United States, despite everything we have available to us. You think about all the cholesterol medications we have, all the advanced procedures that we're able to do now with our cardiology colleagues, still somehow cardiovascular disease is the #1 killer. So it begs the question then, is it really the interventions that are working, or do we really need to start way ahead of time to prevent these from even developing? And I think the answer is probably going to be somewhere around preventing this from even becoming an issue. That's why our executive physical, as you can see, is primarily focused on cardiovascular disease. The second one, which we often don't pay attention to, which I've built in based on personal experiences as well as the data shows that really preventing frailty is a huge another aspect that we definitely focus our time on, because by focusing on this, you will not only improve the things like cardiovascular disease, but things that prevent all-cause mortality or anything that could kill you. people that you would hopefully utilize these services are somewhere around the age of the mid-30s to 40s, where things are still really modifiable. Doesn't mean that later on, any action is better than no action. So of course, anybody at any age group can come in even later down the line. But certainly after you become more along the 50s and 60s, things do become harder to modify, not only because of habits, but because of certain diseases that have probably already set in at that time. Whether it's long-term blood pressure control, unchecked bad cholesterol, diabetes, metabolic dysfunction, these things have had time to kind of seed and really start doing their so-called damage over this time. So really the time to intervene is earlier on by a decade or two. If any of this resonates with you, or sounds like something we could potentially help you with, reach out to me.